Well, hello there. Nice to be with you. This is Conversation Collage, a little podcast we do from time to time. We talk with interesting people. We talk about the things they're interested in. We try to keep it nice and friendly. And if you're not careful at the end of this, you might just learn something. We've been away for a little while with this COVID-19 stuff going on, but we're back, and we'll be back with you regularly from now on. Nice to be back. By the way, I'm Ken Joannesen. Nice to meet your acquaintance or return your acquaintance if you've been here before, and I hope you have. We've got an interesting one for you this time. We will talk about COVID-19. This is our COVID-19 podcast, all right? And hopefully we won't talk too much more about this. Hopefully this will be over before too long, we hope. Knock on wood. We're going to be talking about how the supercomputer Watson is being used to speed responses to questions dealing with COVID-19 using artificial intelligence. And let's get right into it. COVID-19 affecting everyone around the world, and there's been an unprecedented flood of information requests from citizens looking for answers from hospitals, local officials, and other entities. And wait times in many areas around the globe to receive responses are exceeding 2 hours, and many companies are wondering how they can help. And so to the rescue comes IBM, offering their Watson-based virtual agent called Watson Assistant for Citizens. It's being made available to government agencies, healthcare, and academic institutions for at least 90 days so they can provide their people, their stakeholders, with answers to their questions about COVID-19. And we talked about how this is being used with Toby Capello, who is the Vice President of Industry Architecture and Client Success for IBM's Data and AI business.
Hi, Ken.
Hey, how are you doing, sir?
How are you?
I'm doing.
Computer's all right.
I think we're doing all right here. We're hanging in there. How about you?
A little bit of the same.
Yeah. But where are you?
I'm in Austin, Texas.
Is that home base for you?
It is home base for me. I usually travel a lot for business, but as all of us are, I've spent a little bit more time here in the house, in the home office. Not terrible. Got to get out every once in a while and stretch the legs, but it's been good.
There you go. Good deal. Watson Assistant for Citizens. What exactly is that? I know about Watson. That's the big I don't know how big it is, but it's a supercomputer. But what is Watson Assistant for Citizens? This is kind of an offshoot of that?
Watson is the supercomputer. Watson Assistant is a offering that we've had for quite a while on the market that uses our AI technology for leveraging it for organizations. And then the Watson Assistant for Citizens is our offering that we have in the marketplace today based upon the current crisis that we have around COVID-19. It's a virtual agent that allows customers to engage in specific questions about their area, whether they be a government agency, an educational institution, or a healthcare organization, and general questions around COVID-19, like what is it, what are the symptoms, how do I prevent it? And we do that both via chat, that's sometimes called a chatbot, as well as voice, so those organizations can alleviate some of the pressure they have on them right now with the significant increase in requests for information from their citizens.
Okay, so who uses this? Who is this generated or designed for? So
the offering we're talking about, right, Watson Assistants generated and designed for all industries and all businesses. Watson Assistant for Citizens, since we're including and embedding within Watson Assistant for Citizen information from generally accepted sources like CDC, like the World Health Organization, for their answers to what is it, what are the symptoms, and things like that. And that's really going to be the organizations that are looking to provide that information to their constituents. So, for example, the city of Lancaster in Los Angeles County has it on their website. You can ask questions about what are the symptoms and the general questions they have, but you're also going to ask specific questions about, what are the available city services that are open right now, what are the resources that you have for businesses and employees, where do I get tested, and then they'll give you all the locations in Los Angeles County. So it really has application across a number of different businesses, and what's really helping us get this benefit out of these organizations is we are offering this capability to all these organizations 90 days for free.
Okay. So then for citizens, for John Q. Public, they would not access this computer directly. They would go to, say, a city's website, a municipal website, a medical association's website, something like that, and that would ask them a question, and then that would get the answers from Watson Assistant. Do I kind of got that correct?
Yeah, that is correct. So, real simply, if you, like I talked about for the city of Lancaster example, when you click it and use the chat function there, every time you chat and ask a question, it goes to Watson Assistant, which is, behind the scenes, which is in IBM's cloud. That answer comes back, and then you get the answer back to you. So the computing power is coming from IBM, but the location you find it is going to be either the website or a phone number for your local agency, institution, or organization.
Is that a difficult hookup between, say, the city's website or some other website and Watson? Is it nothing? How does one hook up to that?
Good question, Ken. So it's very easy. So we've been able to stand up Watson Assistant on somebody's website within a matter of 3 hours. And the 3 hours, most of it was us provisioning it, testing it, walking through with the customer, and then they embedded the little logo in the corner, and it was ready to go. So you can do it in a matter of minutes to stand it up, and then that compute power, and more importantly, those questions and those answers are at the fingertips of your citizens. About
how many, is there a way to track how many questions Watson is answering through this? I mean, how busy is it?
So there is generally, we can talk about the number of conversations that's happening. When you look at Watson Assistant as a whole, we're still increasing from what we're doing around the COVID-19 crisis as far as the percentage of the total communications. But we have customers that are engaging in conversations up to 100 million a year. Right now, that is continuing to ramp up for this specific Watson Assistant for citizens. Most of the organizations we're working with, they're taking on average between 1,000 and 10,000 interactions a day, and some much more than that.
This is going to sound like a crazy question. I don't mean it to be in a bad sense, but what does IBM get from this? Does it get, say, information? Does it learn more about Watson and what it can do and how, say, flexible it is?
So we're definitely learning about how citizens want to engage with AI technology like Watson. So we're definitely learning about that. The biggest thing we're going to get out of this over this offer we're putting forward is helping these organizations respond to the challenges they have with demands for information and requests. The benefit we get is, the more conversations that go through Watson, the better it learns, the faster it learns. Now, one thing that's very important for us to also clarify is all of the information going to those instances for the city of Lancaster, for the city of Austin, for the Children's Hospital of Atlanta, all of the information specific to them is their information. We don't take that, but we do learn that interaction model so we can improve it for citizens going forward.
Okay. We talked about municipal sites and medical sites and things like that for Watson Assistant for citizens. Let's talk about Watson Assistant generally. What other types of businesses use this?
Yeah, good question, Ken. So we're using it in a number of different places. It's used across every industry and organizations around the globe. Just to give you a couple of examples to make it real. We're using it here in the United States with insurance company Geico. So Geico has Watson Assistant on their website. They've had it for a number of years, and you can ask questions of Watson Assistant about automobile insurance. If you relate it, there's specific questions about automobile insurance in general. The general ones is, what is it, how do I get it, those kinds of things. The specific ones are to do with your state or the type of car that you have. But what it does for the organization, in this case specifically Geico, is the better they can engage that customer in a question and answer, more importantly, the more quickly and accurately they can give them the answers, the better chance they have that customer wants to then become a customer of Geico, fill out an application, and fulfill their insurance through Geico. Mm-hmm. So that's an insurance example. We're using it in other places like Humana, which is one of the largest health insurance providers. And what happens is if you go, Ken, to the doctor and you have a test that's getting done or you just do a normal checkup, that doctor is going to call into, if Humana is your insurance provider, Humana and say, is Ken covered? Used to be you call into a system, press 1 for this, type in your number. No longer do they have to do that. They speak to the phone. I have Ken here. Ken's member number is 12345. Mm-hmm. He's doing a normal checkup. Watson will talk back, yep, I've got Ken here, and Ken's covered. So now you can have a natural language conversation, and it's much more efficient for these providers, and it's going to be better for you as the consumer.
Mm-hmm. Let's see. Is there anything we've missed? I know I'm coming up on time here. Is there anything we've missed that we need to get out to people outside of a website here? Any information we can glean from this?
I think we've covered the use cases are broad, but more importantly, what we're doing right now is trying to stand up things as quickly as possible and make sure we're changing with the changing environment amongst us. So, one of the things that people will ask questions about is every day the guidance changes. How does that work? Well, if it's generally accepted source, when we point to that source, the guidance gets changed automatically. If it's something specific about that municipality or that organization, then they can change that in a matter of minutes, like we talked about before, and stand up on their website. So it's really about speed, time to market, and to respond to what's going on today. And for organizations that want to find more information, they can clearly go to our website.
In this instance, Watson Assistant for Citizens, is this also available for, say, for-profit businesses like small businesses and things like that? People who might be affected by this, can they also use this?
Yeah, so we initially focused this on, as we talked about, government entities, healthcare, and educational institutions. We are broadening the scope of that because everybody's impacted by the COVID crisis for COVID use cases. And so if you are interested, whether you're government, healthcare, or education, or anyone else, if you want to learn how it could benefit you, you can go to our website at www.ibm.com/cloud/Watson-assistant.
There we go. All right. Toby Capello, I thank you for some time out. Best to you down in Texas, and hang in there, and we'll all get through this. Thanks for some time out on this.
Best to you as well, Ken. Thank you.
Toby Capello, Vice President of Industry Architecture and Client Success for IBM's Data and AI business, and we caught up with him recently. And I should mention here the consideration for this chat with Toby Capello was provided by IBM. Conversation Collage coming at you on your favorite podcast platforms, also on Facebook at Conversation Collage Podcast, also on Instagram at Conversation Collage Podcast. So if you'll check those out, like us on Facebook, leave us a review on your favorite podcast platform if you can. Rate us and like us. We'd appreciate that. With this COVID-19 thing, coronavirus, I think everything's changed. This whole world has been kind of turned on its head. And while we're dealing with this right in the here and now, I think at some point, and I know I'm not the first person to mention this, we're going to have to start looking at, thinking about what the world is going to look like once this is all over and we get back to some semblance of normalcy and the quote-unquote new normal. What is it going to look like? How is this going to change the world in almost every aspect? Socially, business-wise, economically, maybe politically. I think there are some ramifications there as well. But we're going to have to start looking at this. What, with so many people working at home now, what is that going to look like once we get through this? Will businesses say, well, we've been doing so well with you guys working at home, why don't you just continue working at home? What is that going to mean for office space and life in the business world, meaning downtowns and in centers of work? If people don't have to go into work, what does that mean for transportation? What does that mean for public transportation systems? Will they see reduced ridership on an ongoing basis? What does that mean for use of automobiles? Will that mean that we buy less gasoline? What's that going to do for the oil industry? What is that going to do for the restaurant industry, particularly being hard hit through all of this? I think these are all questions we're going to have to look at, and we should start thinking about this. I came across a email from Alan Murray, who's the editor-in-chief of Fortune magazine. I get a newsletter from him every day. He writes one called CEO Daily. It's quite interesting. You might want to check it out at fortune.com. And he has written about some studies. And so I quote Alan Murray here. Question: how